Know about tobacco ill effects in your body. Stop taking tobacco.
Subscribe our YouTube channel Medical Help 365 days to see medical related useful videos and press bell icon to get free update.
Tobacco is an additive product prepared from the dry leaves of the tobacco plant. There is more than 70 species of tobacco are known. It can cause multiple diseases, has a severe ill effect on the body. Smoking tobacco causes exposure to a mixture of which about at least 250 toxic, including more than 50 chemicals carcinogens that can damage nearly every organ system in the human body. The most important and dangerous constituents are nicotine, carbon monoxide and tar. Nicotine, which is a highly addictive psychoactive drug. Tobacco use is one of the most important preventable causes of premature death in the world. The World Health Organization, WHO, estimates that tobacco kills more than 7 million people each year. More than 6 million of those deaths are the result of direct tobacco use, while around 890,000 are the result of non-smokers, passive smoker, being exposed to second-hand smoke. What are the common forms of tobacco consumption? Cigarettes, cigars, bidi, chewing tobacco, zarda, gutkha, creamy snuff, dipping tobaccos, hookahs, snuff moist and dry, etc. Know about the ill effects of tobacco. Smoking most commonly leads to diseases effects on the heart and lungs and will most commonly affect areas such as hands or feet issues showing up as numbness, with smoking being a major risk factor for heart attacks. Chronic obstructive pulmonary disease, COPD, emphysema, and cancer, particularly lung cancer, oral cancer, cancers of the larynx, and pancreatic cancer. Know about some common ill effect of tobacco. Cancer. Tobacco contains multiple carcinogenic agents which increases the risk of cancer, particularly lung cancer, oral cancer, cancers of the larynx, pancreatic cancer, bladder cancer, cervical cancer, breast and cancer of the esophagus, etc. Passive smoke may also cause cancer. Pulmonary. It has been noticed and believed chronic exposure of tobacco may be responsible for pulmonary damage and for loss of elasticity in the alveoli, leading to emphysema and chronic obstructive pulmonary disease, COPD. It can cause shortness of breath, wheezing, persistent cough with sputum, triggering asthma, and damage to the lungs, including emphysema and chronic bronchitis. Chronic obstructive pulmonary disease, COPD, is one of the leading causes of death in the world. Globally, more than 40% of all deaths from COPD are attributed to tobacco use. Cardiovascular disease. Smoking also increases the risk of heart disease, stroke, atherosclerosis, and peripheral vascular disease. Several ingredients of tobacco lead to the narrowing of blood vessels, increasing the likelihood of a blockage, and thus can cause increased blood pressure, later heart attack or stroke. After smoking, within a minute the heart rate begins to rise, increasing by as much as 30% during the first 10 minutes of smoking. Carbon monoxide in tobacco smoke exerts negative effects by reducing the blood's ability to carry oxygen. Cigarette smoking can cause lung cancer. American biologists have determined that cigarette smoke influences the cell division in the cardiac muscle and changes heart's shape. Oral. Tobacco can cause oral lesions and cancer in lips, tongue, cheek, mucosa and larynx, etc. It can cause tooth discoloration, severe gum and periodontal diseases. It also may cause xerostomia, which may increase the chance to develop caries tooth in the mouth. Brain. Tobacco, which contains nicotine, it makes you feel relaxation and calmness when you are smoking, but it can make you anxious, nervous, moody, and depressed after you smoke. Infection. Smoking is also linked to susceptibility to infectious diseases, like pneumonia and streptococcus, particularly in the lungs. Smoking increases the risk of Kaposi's sarcoma in people without HIV infection. Impotence and female infertility. The incidence of impotence is approximately 85% higher in male smokers compared to non-smokers. Smoking is harmful to the ovaries, potentially causing female infertility. Nicotine and other harmful chemicals in tobacco interfere to create estrogen, and regulates folliculogenesis and ovulation. Also, cigarette smoking interferes with folliculogenesis, embryo transport, endometrial receptivity, endometrial angiogenesis, uterine blood flow and the uterine myometrium. Smoking reduces the chances of in vitro fertilization, IVF, producing a live birth by 34% and increases the risk of an IVF pregnancy miscarrying by 30%. Pregnancy miscarriages is seen among pregnant smokers on multiple studies. Tobacco is very harmful to fetus. It can cause multiple defects to baby and can cause lower infant birth weights.
At our website www.medahelp365.com, find doctors, hospital, medical service provider information. Read article and lots more. Subscribe our YouTube channel Medical Help 365 Days to see medical videos.